Okay. Thank you, Nessa Bochikendria. To everyone joining us today. It's yet another opportunity to learn and to be able to grow in knowledge. So today we are going to begin with how to position yourself in the job market as a nurse, as a nursing student. I always say that it is one thing to be qualified and it is another thing to be prepared. Because in our educational system here in Africa, particularly Cameroon, where we are mostly familiarized, the system is being training us to qualify to become nurses, but they don't prepare us to become nurses. Those are two similar perspectives, but they are not the same. Yeah, what can qualify you to become a nurse? Maybe it may be a proof of your degree. But what can prepare you to become a nurse is how you can actually do the things that a nurse is supposed to do. Are you able to practice? Are you able to bring out those skills that are needed of a nurse? So all of those things. So now, when it comes to job positioning in nursing, there are two things involved. You need to have what they call a brand and a reputation. A brand is what you make people know you for, and a reputation is what people know you for. Is it clear? Like maybe people know you that you are a nurse. Whenever you ask anybody, hey, who is Bochi Kendria, who is Ashley, who is Agnes? Oh, the first thing that comes to their mind is, no, this is a healthcare provider, this is a nurse. If you're that person that you don't have this positioning yet, you're still far away from actually getting closer to some amazing opportunities. Because when the more people know you, the more chances you have in the job market. The more people know you, the more visible you are in front of people, the higher the chances you have in the job market. Because if people do not know you and what you do, the tendency is that you would miss a lot of opportunities. Being knowledgeable is not enough. Do you know how to be able to make people know that you have the knowledge in this aspect? That is why in this present dispensation, you see that those who win are not actually the smartest or the most intelligent. Those who win are those who continuously show up. They make themselves visible. They make themselves known, even if they are not perfect. And that is one thing that so many people always try to fail to understand is that we want to maybe be perfect in everything before we show up, before we make moves. But in the job market, it is not like that. You start from an imperfect positioning and then you grow with time. You learn through the process. That is what they call active patience. Why being patient? You're doing something to make people know you, to make employers to see you, to make your collaborators in whatever project you want to partake in, to know who you are. And like yesterday, the aspect of technology in nursing was really emphasized. We are living in a digital world. Let me cut you an example. It's like hypothetically, if you meet 10 people in the street casually, I will tell you with confidence that 8 of those people they have social media accounts, they have access to a smartphone. Just like you, a nursing student, a nurse, you have a smartphone, you have social media. Do you know what that social media is being used for? Do you know the use of that smartphone? It's not about posting about the latest or the fashion or the latest musician. You are advertising another person's profession. You are advertising another person's industry. Digital world. It is where transactions occur. And if you're on social media, maybe Facebook, Instagram, LinkedIn, the goal there is to make people to know you. The goal is to make people to know you. Remember, I said the more visible you are, the higher the chances of you getting opportunities. I should not just know you that you are Mbuchi Kendria. I should not just know you that you are Monjuk Agnes. I should just know you that you are Derek. I should know you aside your name, that you are a nurse. You're someone, you're passionate. You get? Because beside technology, in the job market, they are no longer needing intelligence, you coming out with good grades. Those things are important. I am not downgrading them. But I want to tell you that in this present dispensation, there are higher currencies that can position you well and that can buy you a seat in a place of opportunity, in the table of kings, more than your degree. Like they always say, your degree will take you into the room, but it is your competence, it is your positioning, it is your confidence that will preserve you in that room. So, besides just being qualified, having a degree, coming out from nursing school, it is not enough. You must learn the currencies you need to buy the attention of your employers, to buy the attention of those who have power. Those who have power are those who influence life. They are those who change the way our lives run, the way we do things. And these currencies, I always call them life-changing currencies. And you'll be surprised that money is the least of those currencies, because we, like in Africa and Cameroon in particular, many people think that for you to have a good job and for you to have like a life-changing opportunity, you need to use money to corrupt people with power to be able to give you those opportunities. No. Like I said, we are living in a digital world. Opportunities are endless, and you should not just limit your mind or just within your familiar environment. You can explore opportunities in the UK, in the US, while in Cameroon. And what do you need? You need the first currency is what I call relationships. Relationship. What relationship do you have with your professor? What relationship do you have with your classmates? What relationship do you have with your nurse supervisor during your clinicals? Are you that student that you're known for causing havoc, for always missing out some more, important appointment during your clinicals? That already speaks volumes about you. And you never know who will recommend you for a certain opportunity. So you need to take your relationship very serious. Right now, you need to start having a good connection with your professor, because now the way you interact in class, the way you maybe ask questions, strategic questions, professional related questions to your professors, to your classmates, or to senior colleagues, it gives them the impression that this is someone who has clarity. This is someone who knows where he or she is going to. And when people start having this understanding about you, that you are someone with clarity, you're someone who is committed to excellence, whenever an opportunity shows up, they will always think about you. And one way to secure this relationship currency and use it for your benefit is always be resourceful. Always be resourceful. Show up when it is needed, do what is right, and help people to achieve certain things which might not be related to your own priorities, but help others. The more you help people, the more people help you. Do you help your friends in trying to explain a concept that they don't understand? You might not know that your friend might know someone who knows another person that have an opportunity that you need, and that friend will just remember what you did that will influence him or her to be able to say, no, I have this friend. Give him this opportunity. Give her this opportunity. So you must be able to know how to use this currency. Another currency that is most needed when it concerns positioning is passion. Passion is a currency. There are some of us, we don't have, we are not coming from good backgrounds, but we need to change, we need to grow, we need to explore opportunities. What can you do? Tell the world that you're capable. And to tell the world that you're capable, you must show some enthusiasm, some passion, some love for what you're doing. Like social media has come and make it easy. Like I said, the way you continuously show up, what you continuously post online, it tells the world who you are. You cannot see someone who is passionate about healthcare posting about music. Once upon a time is good to do that because it is a form of therapy, but it should not be a culture that every day when we are when we are going through your social media, your Facebook feed, all we see is you posting Davido music, you're posting about fashion. Meanwhile, you're a nurse. It means you're someone who had misplaced priorities. You just accidentally found yourself into nursing. But if you're someone, you every day you post about how passionate you are about nursing, what you expect from this profession, and the kind of loopholes or the advantages found in this profession, it will make people to see that no, this is someone who is really committed. This is someone who can actually change systems. And beware, your employers, your destiny helpers are on social media just the way you are. So whenever they see that passion in you, it bridges that gap. It brings you closer to them. And you never know. Your passion may just be that validation that you need to get an opportunity. There are some people who just sit and then opportunities come to them because they have proved themselves beyond all possible doubt that they can actually do what they say they can do. So passion, don't just say you are passionate. No, a passion that is not driven by action is just futile, it's meaningless. So one thing that you need to write down as, can I say, a to-do list is that if you're passionate about this profession and you want to make a difference and you want to distinguish yourself from the crowd, show up, be visible, make people know who you are, what you're passionate about. It is already building your identity. It is building your reputation. It is already making a brand for you. A brand is what you make people to know about you. What impression you create in the minds of others about your personality. When I'll see you tomorrow, what will come first to my mind? The first thing that should come to my mind is that this is a nurse, this is a healthcare provider, this is someone who is committed to professional development, personal development. When you continuously create this buffer in the minds of people, whenever an opportunity shows up, they'll always think about you. They'll always want to recommend you because you have proven yourself. When people are doubting themselves, you're doubting and showing up. So your reputation and your brand are things you need to take very serious. Your social media, your Facebook, your LinkedIn, your Instagram, your WhatsApp status. It is not to post about one Nigerian musician. It's to say yourself. That musician you're talking about, the person has created a brand in your mind. And that is why you are advertising That is why you're expanding their market. That is the same thing you should do. Continuously tell people who you are, oppress them with who you are and what you want from them, so that they would expand your market, so that they will talk about you in places where you are not, in your absence. That is how you create a brand. That is how you command opportunities. It is a law of attraction. The law of attraction. There is this book called Think and Grow Rich. In it, it's written a poem called "Life is just a fair judge. It gives to you what you give to it. If you show up positively, life will give you the positivity that you expect." So, hope you are taking notes. I hope you are taking notes, because these are things you need to go hide them. You don't need to show the masses. You don't need to show people, the people who don't want to pay the price, people who don't want to be committed to personal and professional development, because the tendency is that you will come across, just like Neskendri Yambochi was saying yesterday. You have to have some core values. You have to be that person. You have buffered your mind about the things you want, about the people you interact with. Let nobody deceive you that nursing is not your calling. Let nobody deceive you that there are no opportunities in nursing. If there are no opportunities, create them. And how do you create them? Is the way you look at things. While others are looking at problems, you look at solutions. Just imagine that you go on clinical internship as a nursing student, and you realize that the documentation procedure or the documentation routine that is being carried out is not the best. That is a problem. Most of the times, the thing that downgrade us as nurses is because we like going the traditional way without questioning that practice. When you question traditional routines, you position yourself as a leader. You position yourself as a competent and a valuable person who can change problems into solutions. Remember, when you are showing up as a resourceful person, someone who is not just coming to fit into a job, but someone who is coming to complement and improve a position, maybe a job position, there is a higher tendency that company, that institution is going to take you beyond that person who just showed up with a degree. So problem solving is another way to position yourself in the job market. Look at problems around you. Because as we are talking about job positioning in nursing, don't be surprised that tomorrow you might be the employer yourself. Let us not just limit your thinking to just think that after nursing school you can just go and then your life just ends up being an employee or just seeking for jobs. You can be a job creator. There are so many problems in the field of nursing. And like Dr. Miles Monroe will say, wherever there are problems, there are businesses. Do not limit your mind to your familiar environment. I know that in our environment, the way nursing was initiated, if you date back to history, nursing was not actually it was not regarded as a profession. And it has created a stereotype. So you need to change that mentality. And for you to change that mentality, you need to know that you are fighting a whole system. And you cannot fight a system without competence. And you cannot fight a system without knowledge. There are some job opportunities that you just walk up to and say, this job belongs to me. That is like audacity, because you are confident you can do it. Meanwhile, there are people that the system has positioned that they are the ones to take these job opportunities. As you all are listening to me, ask yourself, ask yourself, will I be the first nurse to become a director in one of Cameroon's public hospitals? Will I be the first nurse in Cameroon to attract global job opportunities? This is how you ask strategic questions that rewire your mind. Now, the most important thing that I really want to talk about, it is something that we have designed and made it possible in the worksheet that was being sent into the group. CVs, curriculum vitae. Like I was saying in the beginning, it is one thing to know who you are, you do, and another thing, articulate that which you know to people who do not know you, so that they might know that they might have that impression that you are this position. Yeah, you might be qualified and you are already equipped as a nurse, but you do not know how to explain yourself or articulate what you can do and your qualifications to an employer. That is why I created a tool that is going to ask you a CV format. For those who have already put the worksheet, you will see a section where you can just read, and just from following instructions, you can develop a good CV. A CV is what you tell an employee. I don't boost your mind with a lot which is already well designed in the worksheet. So no matter how qualified you are, you need to know how to position yourself in the job market through the way you present yourself to an employer. And like I said, there is the verbal and the non-verbal way. You get the verbal way is when maybe you're called off an interview or so, and then you're telling the employer who you are by yourself. But the non-verbal way is like articulating your qualification, your experience, and how fit you are to that job position through what they call a curriculum vitae. Meaning a curriculum vitae is something, it's a document that tells the employer who you are, your qualification, and your expertise. So now, a lot of people confuse about a resume and a CV. Those are two similar aspects in trying to articulate or trying to showcase your skills. They are similar, but now a CV is a generalized aspect of your professional and academic journey. Meanwhile, a resume is a CV that it has been specifically designed to fit a particular job role or a particular job positioning that you're applying for. You might have a CV that talks about your academics, your professional life, and your experience in all the industry you have worked in. But the resume is a particular aspect of a CV that actually tells the employer what you are applying for that is in line with the job description that was communicated in the job advert. So you need to know all of this difference. So after this, you need to go through the worksheet that we designed. There is a simplified CV format that you just need to follow. Just to summarize the format, when you're going to look at that CV format that has been designed, you see that in a CV, first we always have what they call the profile, your profile. And in your profile, you have your name, the job position you are applying for. If you're applying for a nursing role, you should state there. You have your email, your telephone number. And most importantly, though it's always optional, but I would advise that whenever you're applying for opportunities, especially global and international opportunities, you always include your social media handle accounts, most especially LinkedIn. From the profile section, you go to what they call a professional summary. And in a professional summary is just a 4 lines, like a 4-sentence, not more than 40 words, that tells the employer in short, or the human resource manager, your experience, what you will contribute to the institution, and how and what you expect to gain from the institution. Because the mistake people make is that you just go and you're applying for a job without actually knowing why you want to apply for the job. You need to state why you are applying for that job, what you are going to contribute, and what you envision to gain from that job. It is a mutual aspect. So you need to be able to state this and your experience. That is just what it entails in the professional summary. Why are you applying for the job? What do you envision to gain from the job? And why should we employ you? These are the questions that you answer, and that is what makes up the professional summary. It should not be more than 40 words. And then you go to your education qualification. You need to list your various qualification, and in this you don't list them chronologically. You always reverse. When you look at the CV format, you're going to see how examples were being made, so that it's going to be easy for you to do that. And then the next section is about your experience and roles. In your experience, you're stating what the particular role you had in the previous company or institution, and what you did, what you achieved in that role that brought an impact or a positive growth to that institution. And when writing your experience, always make sure that you write using active past tense. For instance, maybe when during your clinical internship, you learned you learned about vital signs monitoring, like a BP, respiratory rate, and all, and so on and so forth. So now when you're putting it down in your CV, you always state that you always state in active past tense to show that you already have these skills. You already have hands on these skills. You're already a master of these skills. You always use words like active past verbs. Sorry, I said past verbs, like mastered, gained, developed. These are just examples. You can always bring out any of these past active verbs that can fit into that description. And you always have a timeline always have a timeline. State that maybe you had this job, this role maybe for 2 months, and then you achieve this and you achieve that. So that is all about the experience section. And then you can go down, and then you have the section for skills. You just need to just summarize. Maybe you break them down into two: the soft and the hard skills. The soft skills, you're talking about your communication, your teamwork, emotional intelligence, cultural sensitivity, and so on and so forth. This is, and then your technical skills, you're talking about what you can do confidently and independently as a nurse. And one thing, especially when applying for some global opportunities, is that except it is being stated in the job role, in the job description, never includes your computer skills. Never include your computer skills, because we are living in a digital world, and employers have this impression that you already have these skills. You already have this mastery of these computer tools, except it is being asked in the job description. And then the last section is always the language, where you state the language that you're proficient in, and that is all. Never include, never add the reference or recommendation number of your mentor, of your professor, except you're being asked to do so. Never include your gender. Never include your marital status. Never include your like your GPA or anything. All of those things will bring bias. All of those things will create a bias in the mind of the human resource. So that is what it entails for CV writing. Because if you don't know how to write a CV, you know how to attract an opportunity. You can be qualified for a job, but if you don't know how to apply for that job, you're going to lose it. So I believe that after this session, we all are going to go through the worksheet, use it, design a CV. I'm going to create a question where each and everyone in the group will have as an assignment to write a CV and send for a review. For the aspects of social media positioning and how to go about it, I am going to help those who don't know how to position themselves on LinkedIn, how to create your LinkedIn account, and how to be able to use it for impact, for opportunities, and so on and so forth. I believe that I have exhausted so much, and we'll keep sharing as time goes on. Cheers. Over to you, Kendria.
Thank you so much, Stanley, for that wonderful presentation on how to position yourself in the job market. I think that is a very important thing that we need to consider today, because at the end of the day, there are things that we can deal without, there are others that we cannot deal without. And when it comes to people knowing you, and again, when you talk about job positioning, a lot of people always push it to social media, but that is not only it. It also includes, like you rightly said, our relationship with the people that we have around us. Sometimes some people may have some opportunities and they don't even know that you're looking for it. So the more you connect with them and you're able to speak with them, even if it's on a mutual basis, and be like, oh, please, I'm really looking for this. You might say, oh, okay, I know somebody that is looking for this person. So again, the positioning also means creating those relationships and also being open and genuine with your interaction with people. That is very, very important. Thank you so much, Stanley. So from there, the next thing we'll be talking about is on communication in nursing. And please, if you are able to go through your worksheet, the place where we have the universal nurse patient communication script, I'm going to go through that while talking about communication in nursing. So at the end of the day, whether you like it or not, there's no way you can be a good nurse without speaking to your patients, your colleagues, or other members of the multidisciplinary team. You always have to speak. You always have to say something. You always have to give, details about the patient, be it during handovers or when you're asking for questions. So there's no way you can escape communication. And communication is important, but yet it is a very sensitive thing that if you miss out on it, or if you're unable to communicate based on the people involved and the situation, you will end up being misunderstood. And that misunderstanding can go as far as putting the patient at risk. For example, maybe you want to communicate the patient's prescription and you don't do it appropriately. Somebody might reason it differently and end up giving the patient an overdose or an underdose. Or maybe the doctor is trying to relay an information to you, and because maybe their language, they are using medical jargons and you don't understand it, and you're not that confident enough to ask, oh, I don't really understand this, can you clarify this? At the end of the day, you end up doing something else that is going to hurt the patient. And coming to us like colleagues, if you're not able to communicate appropriately with people, you end up saying something and think that, oh, that's fine with you, but at the end of the day, you're hurting somebody's feelings, and constantly people always think that you're not a good person, whereas it's just that miscommunication. So communication is very, very vital in nursing. And one of the ways that you can actually communicate well in nursing is always to see everybody as an individual. Don't always expect that people are the same. There may be two patients in the ward and they have the same condition, but one person understands better while another person doesn't. And again, it goes with your colleague. Don't always assume that everybody understands what you are saying or they are able to comprehend it quickly. And on your own part, don't always try to assume that you understand everything. If you need help, ask for help. If you need clarity on a particular thing, ask for it. Don't just say, oh, I don't want to bother this person asking the same question over and over again. Because at the end of the day, that information is, if it's something that is very vital, you need to treat it as vital. So those are the kind of things that you need to take into consideration. And looking at the nurse patient communication script, people, if you're especially in an African setting, everybody considers anybody, most of the patients considers everybody putting on white to be a doctor. So there is this tendency that you might just feel comfortable because you're in white. Everybody should assume that you are a nurse. So you don't need to introduce yourself. You don't need to say anything. You just need to carry on and do what you want to do. But that is not right. If you look at the way we do with nursing, generally, you need to communicate with the patient. They need to know what is happening. If you're changing something, they need to understand. And even before you want to do anything with them, you must introduce yourself. And if you're a student, it might be a bit tricky because you feel like, oh, you're not part. You might feel sometimes like you're not part of the team, so you don't have that accountability or you don't have that responsibility to be accountable. But that is not true. Anything you're practicing now will also affect the way you later on practice when you're fully qualified. So that's something you need to take into consideration. And introducing yourself is a very, very important thing when it comes to nursing. Please never assume that everybody understands you or everybody knows.
I think you are muted, please. You are muted. No, we cannot get you.
Oh dear. What about now?
Okay, yes, we can hear you now.
Oh, I'm sorry about that. Did that happen for long?
I think like 2 minutes.
Oh my God. So, okay, I'll just go back again and start from where I stopped. So what I was saying is you should never ever assume that the patient knows what you're talking about or the patient understands you without you explaining yourself. And if you were with the patient, like let me say you've been taking care of that same patient for 3 days, don't just assume that because you've been with the patient, that means it is okay for you to just crack on. No, you still need to introduce yourself every now and then when you're coming to the patient. They need to know who you are and what you will be doing. You don't just need to assume that, okay, this is
this is me in white. I am a nurse, and carry on like that. So the next thing is what I was trying to say is sometimes we have a lot to do. We have a lot of patients to look after, and that thing can make us to become too tax oriented, and we are no longer patient focused. What do I mean? You might just come because you have this patient to administer this medication. You have to take care of that. You have to take care of this. You just feel like, okay, you just crack on without even checking on the patient. Because sometimes just asking the patient, are you all right? They might tell you something, that a new symptom that they are experiencing, that maybe you need to escalate that to the doctor. But if you just come in and you be like, oh, I'm here to do this, and you just crack on without even checking on the patient. Some of the patient, they don't have the courage to sometimes speak. And sometimes when you ask them question, that is where they can be able to say something. So get that into that attitude where you can actually just ask the patient, are you okay? Are you okay today? Just find out, because sometimes there might be something that they need extra, or something that you have to tell the doctor that might end up needing that they should stop the medication you were about to administer. So we always have to be that incooperative. We always have to be that adaptable, and know that at every point in time we are checking on the patient. I know it can become so overwhelming sometimes, especially when you are alone, or maybe you have a whole lot to take care of many patients, documentation and different things. But again, please, at the end of the day, patient safety is also as important as whatever you want to do. And again, when you explain what you want to do, at that point in time, don't just assume that the patient understands it. Ask questions. Do you understand what I need to do? That conversation, if I'm explaining it broadly, might feel like it's a conversation that will take you 10 minutes, but that is not a 10-minute conversation. It's a quick conversation. But the only thing is you're including the key points, and you're making sure that you are asking all of those questions and listening to the patient in return. Okay. So ask the permission. I don't know. The consent is something that is very important. And especially if you intend to move abroad, know that consent is very, very important. It doesn't mean, even if you need to raise my hand up as a patient, you need to ask my consent. You need to tell me what you're about to do. Because I know it's not very common with us in our African setting. You just feel comfortable with everybody, and you can just move patients around without even asking them. But when it comes to nursing abroad, consent is as important as what you are doing. If a patient says no to something, there is nothing you can do about it. You can only tell them the risks and the benefits and let them to leave the decision to them. But just going ahead and start doing things, or just get into the ward and the patient has things on their bedside cupboard and you start shifting it, moving it away to put your medication tray, that is not right. It is not seen as a professional behavior. You need to ask the patient. When you come in, you ask the patient, okay, I'm about to do this. Can I move this? Can I do this? The patient should always be involved in their care. And at the end of the day, when you involve a patient in their care, they feel comfortable, and they will most likely comply to any adjustments that the doctor is giving or anything that you're doing. But if they just feel like they are in a place where they are just following instructions without clearly understanding what you are telling them, at the end of the day, they will hardly comply. And that works for every human being. If you feel involved in anything, you will possibly put your best. But if you always feel like you are an option, or you are just there for the sake of it, I tell you, you will not be motivated at all times to put your 100% best, right? And if you're doing a procedure, let's take, for example, cannulation, which is very common, please make sure you're talking the patient through it. Don't just start and okay, once you've already told the patient at the beginning, this is what I'm doing, then you just continue until the end when you've put the plaster and you're leaving without talking. You need to constantly check, okay, is the patient okay? Are you okay? Any pain? So that if there is any pain, you can stop, or you need to change your direction, or there is something you need to do about it. Walk the patient through that process. Communicate. Speak to the patient. Ask questions. Are they okay? If not, at least you'll be able to identify that something is wrong with that. And this thing is not a one size fits all, really, because sometimes there are patients that just need that immediate intervention. But what I'm trying to say is, even if the patient is unconscious at the moment, if you are moving the patient, speak to them. Anything you're doing around them, speak to them, because even though they're unconscious, they can still hear you sometimes. Even if they don't respond to you, always know that they are listening. And at the end of the day, maybe when they regain their consciousness, they might say, oh, I did not feel really comfortable, I was not treated right, or something like that. Always try as much as you can to explain the procedure, introduce yourself at all times, and make sure that the patient is comfortable. And this leads me now to public speaking in nursing. This is something that looks very, very complex, but on our day-to-day practice, we do speak, don't we? Handovers, we speak. talking to patients, talking to the doctor, other members of the team, we do speak. The patient's relatives, we do speak. But when they say public speaking, we start imagining that it's something that is very fictional, but that is not true. And as nurses, we must develop this attitude to speak publicly. Why? Because first and foremost, we are an advocate to our patients and we are advocates to ourselves. So tell me, how do you intend to advocate for a patient if you cannot speak up? If you cannot speak up, how will you advocate? Because advocacy also means speaking up, identifying that, oh, this thing is not right, and trying to say, okay, we could do it this way. But if you're unable to actually speak up, how do you intend to do it? It's going to be difficult. It's not impossible anyways, but it's going to be very difficult. So learn to speak. If you have an opportunity to speak, speak up. If you have an opportunity to do a presentation, do a presentation. And again, when we have opportunity to go for interviews, we do speak, don't we? At that point in time, what are you doing? You have 2 or 3 people listening to you. That is also public speaking. So it doesn't have to be a crowd of 20, a crowd of 100 people before you say, okay, you're actually speaking. If there are 2 people, 3 people involved, you're already speaking. So you need to train yourself. Sometimes you just need to stand in the mirror and do a presentation. Have a 1-minute script, or for example, if they ask you, Agnes, who are you? In 1 minute, you should be able to clearly tell people who you are, what you stand for, and what you do. You need to, we call it a pitch. You need to have a pitch. It is very important because even when you want to introduce yourself for interviews, you talk about your name, isn't it? You talk about yourself a bit. That is also a pitch. So you have to practice that pitch. Have a 1-minute pitch. So that's an assignment for all of us. Have a 1-minute pitch. If you wake up in the morning and somebody asks you, Joviana, who are you? Can you tell us a little bit about yourself? In 1 minute, you should be able to clearly communicate who you are, what you stand for, and what you do. That is very, very important because it is not only in our personal lives where they say first impression matters. In every professional setting, first impression also matters. So you should get to a place where you learn to speak. And that is very easy to achieve, especially if you're still students. If you have the opportunity to participate in group assignments, participate. If you have a presentation to do, don't step back. If everyone else is stepping back, take the bull by the horn. Sometimes you might feel like the first time it's very difficult, but subsequently it is a skill. Public speaking is a skill, and like every other skill, practice makes it perfect. So get into the habit of learning how to speak, opening up to learn how to speak, because again, sometimes we have to learn that skill. Not everybody has that natural ability to just speak anywhere comfortably, but it is a skill, and that skill can be learned, and it is a vital skill for us as nurses, for yourself, and even for the patients that you are interacting with. And yesterday we did talk about excellence, and I did mention that today we will talk a bit more about the 6 steps of mastering any clinical skill. And if you currently have your worksheet now, you'll see that section of it, the six steps to mastering any clinical skill. And you'll see that the first thing is to learn the science behind it. I tell you, there is a difference between 2 nurses. You see a nurse that understands the rationale behind something behaves differently from the one that is just practicing or just being a robot. And you don't want to be a robot. You should understand the rationale behind everything. For example, if there is a procedure that you need to carry out, understand what that procedure is. What is it behind that procedure? Before you go to learn how to do it, know why you are doing it. Understand the science behind it. Study to understand it. If you don't know the theory, and when we were talking about how to link theory with practical yesterday, the theory will guide you how to practice. But if you don't know the theory at all, how do you intend to practice it safely? That is first and foremost very important. And the second thing is you need to observe. Observation is very important. Observe, stand and watch somebody perform that skill. Look at the details involved in it. Pay attention to what they do step by step before you begin to do it. Again, we are dealing with people. We are dealing with people that have feelings, and you don't want to make an error, especially the one that is avoidable. So you need to observe. And when you're observing, you're noting the key points, you're noting the key steps involved, and you're making sure that you're capturing all of them and not, downplaying any of them. And the next thing is do it slowly. There is no rush, really. Sometimes, it's okay to say, please, I don't know, can you show me? Please, I'm not comfortable doing this thing at this moment. Can you do it? Can you help me out? Please, as a nurse, in this generation that we find ourselves, be comfortable to ask for help. Sometimes you're not just an expert, or you're not really perfect in doing something. Ask for help. Don't think that this person might think that, oh, I'm not really an excellent person, or I cannot do this skill, therefore I'm not really. No, you're not only saving yourself from trouble, you're also protecting the patient from harm. If you need help, ask for help. If sometimes you want to perform a skill and you're not 100% comfortable, ask your colleague, please, can you stay with me and just watch me do this? It is very important. This is for patient safety, most especially. And the next thing is, try to explain that procedure to yourself. After you've practiced it, you've done it the first time, try to explain it again to yourself. I call it teach it to yourself back. Okay, can I actually visualize this thing again, step by step, and understand what I just did? Because sometimes if you're doing it, you might just be robotic and end up forgetting the steps. But when you come back and you're like reflecting on what you did, and just think about it, what did I just do? How did it go? What are the steps I actually follow? Did I follow all of the steps? That will help you stick. That will help it stick. And the next thing you want to do is you want to repeat that skill. You want to repeat. Every time you have the opportunity to perform it, try as much as you can to do it. Don't ignore it. Don't say, okay, now I'm competent in it. I've done it twice, so I know it. No, just keep doing it. Every now and then when you have the opportunity to do it, keep doing it. And again, always try to reflect on your practice. As nurses, the more reflective you are, the better you will become in every skill. Always try to reflect on it. What did I miss? What should I have done better? What are the things that I should have avoided? What are the things that I should have included? That will help you a lot. The more you reflect on your practice, the more you are able to improve on yourself. Nobody knows it all. Nobody is a complete expert in everything. That is why there's always room for improvement. And for you to be able to improve, you must be open to constructive feedback. And that feedback should not only come from others. You can actually ask yourself for feedback. How did I perform today? The skill I just carried out, how did I do it? How did I communicate with that patient? Was that really respectful? Was that very inclusive? How did I communicate with my patient, with my colleague today? Was it really okay? Was I being rude? Is there something I should have done better? So being reflective also helps you to improve on your practice. Again, like yesterday, please, if you have any questions or any comments, you can drop it in the comment section and I'm going to respond to the questions. And don't tell me you don't have any question, because there must be questions. And like I said, I encourage a lot of questions, because sometimes you might doubt a little thing, and in the course of asking that question, you end up learning something that will help you, and others might also learn from your questions. So please do ask your questions if you have any. And this leads us now to one of the most interesting and very key topic of our event, the future of nursing. We cannot talk about career advancement opportunities in nursing without talking about the future of nursing. If you don't know what the future of nursing is, you won't even know what opportunities lies within it and how you can position yourself for those opportunities. We've already talked about how to position yourself in the job market, but now understanding the future of nursing will also help you to strategize towards it. So if you look at how nursing has moved, especially after the time of COVID, a lot of things have changed in different industries, including healthcare as well. And if you look at it, nursing is moving towards more technological advancement, AI, and community-based healthcare. Very important, community-based healthcare. So most healthcare systems are trying to move care from hospitals back into communities. That is to say that they are making sure that patients can have that autonomy over their care. People can be actively involved in anything concerning their health, because when you're actively involved, it leads us to preventive healthcare rather than being reactive or looking only for treatment. Because if you look at hospitals in general, majority of the times, people only come into hospitals when they are sick. They will just want to go for treatment. Very few people go for regular checkups or just go because they want to know what is happening with their bodies, right? So most healthcare systems are trying to move care from hospitals back into communities. And if you look at this aspect of moving care from community from hospitals back into community, you will see that there are a lot of opportunities that we can exploit as nurses. And looking at the technological aspect of it, we can see that there are also opportunities that we can achieve, we can exploit. And again, if you look at the technological advancement and moving care into communities, there is a connection between the two. Why? Because you will still be able to leverage on those technology, those tools that are available, and be able to use the opportunity to take advantage of the opportunity in the community. So you are using those tools to enhance your practice. So when it comes to technology and AI, we'll see that a lot of opportunities are arising now. And the good thing about nursing is we do have transferable skills. That means we are not always starting from scratch all the time. That is a good thing about nurses, because we are people facing. We are people facing all the time. There are a lot of skills that we learn. There are a lot of experiences that we gain just by speaking to the patient, just by encountering different professionals on a daily basis. We learn a lot. And the skills that we practice in our like clinical skills, some of those skills are transferable. So that means you can actually pivot your way from a bedside nursing role into a different industry using those same skills. So you're just transferring those skills into that new industry or that new career path that you're navigating, right? So when we look at it, you see that a lot of things are coming these days, and we see a lot of opportunities for telehealth nurses. Virtual assistants, very important. There are nurses that are just there to do education, and there are more devices that are being produced with the technology coming in now. There are more devices, wearable devices that are being produced, and sometimes they need us as nurses that we've been with patients to actually test those devices, or actually know that, okay, to say that, oh, this device, I think it will work well, or bring our knowledge so that those devices can be tailored to suit the patient needs, right? So that is to say that the manufacturing industry, we can still fit ourselves in there. Why? Because we've worked with those patients. We've known how previous machines or BP machines, be it the electronic ones or manual ones, do work. We've worked with them, and we actually can give that first-hand feedback. And that first-hand feedback that we are giving to those companies, it is very important, because they are using the feedback to improve on those services. So that is already an opportunity for us as nurses. Again, not everybody has the opportunity to come into hospitals when they are sick. There are some people that just have very basic things that they just need help instantly. Sometimes they just need a telephone call. So as nurses, if we have that experience, that means we can actually talk to them. We can get employed to talk to those patients, get their information, and they can carry their care from there. So that is to say that all of these tools that we have out there, we can actually use them for our own benefit. And going down now to moving care from hospitals into communities, what does that mean? That means healthcare professionals that are focused on preventive healthcare, they have so much to enjoy. They have so much that is already hidden there, like in terms of opportunities. Because if we are looking at preventive healthcare, that means health coaches comes in there. That means preventive health strategies, they are coming in there. That means education, those that are out for health education, they have a vital role to play. Those that are content writers, if you're able to do if you're a copywriter, you have a place to play there. Why? Because there is no way you can talk about sensitization without writing. We live in a content creation generation. So people can be informed through reading, they can be informed through videos, they can be informed through different things. So if you're able to write, there are companies that can actually say, okay, or NGOs, and sometimes you need to approach them. If you're a good writer, you say, okay, I think I'm a good writer, and you show them proof that, okay, I've been writing even for your own self. And this is when the importance of social proof comes in. You've written for your own self before, and you say, okay, this is what I've been able to write. So can I volunteer and write for you for some time? After 6 months of writing, you yourself, you can say, okay, I've written for you for 6 months now, I'm charging this. And if they are happy, if they know your value, they will keep you. So that is to say that when it comes to content writing, even in the next 10 years, it will still be relevant for nurses. It is a place where you can specialize in, because even the companies producing machines, they need somebody to write about those machines. Even NGOs, they need somebody to write about it. Health institutions, if you look at it, there are many health institutions that now are writing about their health institution online. So that means you can actually approach them and say, okay, I'm able to write for your company, and this is the contract. I might do it for the first 6 months, and you see what happens, and then we can carry it from there. And a lot of things like that. And one thing you might be wondering, oh, we have AI that can actually write, but AI content lacks one thing, which is the human feel. If you read an AI generated content, especially if the person has not mastered prompting well, and you read information, another content that somebody wrote, raw content, right, without necessarily being written by AI totally, the difference is always very clear. There are words that are auto-generated by AI that you cannot remove it, because again, the human mind thinks critically than any AI tool. No matter how much you try to say it's artificial intelligence, itself only telling you it's artificial tells you that it can never be 100% accurate as a human mind. Secondly, when you look at it, if you look at the way these models are built to behave, once you give them a suggestion before, the next suggestion they can give you sometimes is based on what you previously told them. So your input itself is also helps them to generate it. So that means if you're able to write genuinely, if you're able somebody who is able to write good content, and you're using those skills, those tools to enhance your writing, it will even make you stand out more, because it will save you the time of trying to edit it. Because sometimes when you write, you need to proofread, and sometimes when you're proofreading, you might miss out on some important things. But if you've actually written your script or whatever, and you're putting it in there to say, okay, correct these errors or repurpose it for different platforms, that will be helpful. So don't say, oh, we have AI that can actually generate us pictures or generate us videos or write content for us. Companies are still looking for people that can actually write human content with a human touch. Because take, for example, even if you want to explain, let me say malaria to a common human in a village, AI can do it. But do you know there are some basic terms that you're used to using in a community that when you use those same terms, they will be able to understand clearly. So that is to say, sometimes they can just give you generic content, but you need now, as a professional who already understand the skill of writing, to now tailor that content to fit your specific audience or whoever you're talking to. And sometimes it's not only about writing on social media. You might be called up for a presentation in hospitals, especially when we have like cancer days, World HIV days. They might call you to write a content or script for a particular presentation or to present on a particular topic. So that is where you're also writing, aren't you? And again, another aspect of nursing that we can actually enjoy with this movement into communities is preventive healthcare. So you're not coming to tell the patient that, oh, this is medication, take this medication, take this. You're coming to sensitize the public. And that sensitization, you can still monetize it, okay? So you're not just coming to just tell them this or go and take this medication or that. You're not the doctor here. There are different things that you can develop. You can develop things that like a script or a worksheet that they can actually walk through as families to see how they are looking after their health, the key things that they need to monitor. Or if you're someone that is very interested in sexual and reproductive health, you might say, okay, as a mom, I have developed this checklist. These are the things that you need to check before while you're preparing for your baby. These are the things you need to check. Or once you have your baby, these are the things you need to check. You develop those things into worksheets and you can sell them out. Or you can create them as video content and you sell them out. That is to say, at the end of the day, no matter what you're doing, you still need to speak. You still need to learn how to speak. You still need to learn how to write, because that is the way you also help to sell yourself out there. And again, you don't only end up creating for the public, you can also create for organization. There are NGOs that are really geared towards maybe, let's say, sexual and reproductive health. Others geared towards preventive health. That means that you can also be a consultant for those companies if you actually master that skill and you actually understand that this is what you need to do, these are the things you need to do. And again, you need to know that these things, you don't need to be a complete expert before you start. No, you don't need to be 100% expert before you start. Start where you are with what you have, what you can do now. You don't need to be an excellent writer. You don't need to be an excellent educator before you start educating. Start with what you know, but make sure whatever you're teaching there is evidence-based and you're able to back it up with research, which means you will need to also read. You also need to learn from other experts that have gone ahead of you, right? And looking at the community movement from hospitals to community again, that means in the next couple of years, we will need more healthcare professionals, right? And this is also a good place to leverage on. That means mentorship and coaching for new nurses or student nurses will also be an important part that you can exploit. Because, your experience, the things that you went through, the things that you're going through now is something that somebody can learn from. That means you can be a mentor to other people. You can be a coach, a career coach for different people, or a health and well-being coach for different people. And that is also a place where you can specialize in. And you don't have to make it a full-time job. It could just be a part-time job when you're having your extra income. So I don't know if you understand these things, and if you can clearly understand what I'm saying when it comes to these opportunities. If there is something you're already grasping, or there is something you think you're going to be focusing on, just drop it in the comment section if you understand this topic, because this is something that needs to be practical. It is not a theoretical topic. No, it's something that is very practical. So as I am explaining the concept, you should be able to start understanding that, I think this is where I want to focus on. I think this is what I want to do in the nearest future, or this is what I started and I need to continue with it. So just 2 minutes for that exercise. Is there anything that you think that you are finding interest in, or you found interest in previously, but you've not actually been intentional about it? Just drop it in the comment section and we'll write on from there. So these things are very important, right? These are the kind of opportunities, because you need to look into the future and see, because now the things we are exploring now ends now. But if you're able to look into the future and see what is still ahead, it will help you to position yourself and to strategize yourself at all times. Because the earlier you identify an opportunity, the more you are able to leverage that opportunity and enjoy from it before many people start getting into it. So do let me know in the comment section if there is anything that you've picked out. If you want to share it, good and fine. But if you don't want to share it, that's okay. But just indicate if there is something you're finding interest in already, or there is something you already found interest in, but you just neglected it or thought it was not really important. It is important. What I'm trying to make you understand is there is always an opportunity for us nurses. But the thing is, we need to take ourselves out of the square box, out of the bedside mentality that we previously had, and see that we can exploit different opportunities, even if it is within the healthcare industry or different industries. We have that liberty to actually try different things and see what actually works for us. I haven't seen any comment yet from anybody. Doesn't mean nobody has seen anything or thought about anything he or she wants to do, or related to anything they previously really wanted to do. Anything? Okay, anyways, I'll wait for it for later. Anyways, anything, if you drop anything in the comment section, I will definitely take note of it. So, okay. So the next thing we're going to be talking about today is competence and confidence. These two, I love talking about them together because they work hand in glove. Sometimes you might be so competent in a skill, but if you're not confident enough, you will still be seen as someone that is not competent. And sometimes you see somebody that is not really, really competent in something, but at the end of the day, because they are so confident, you see them taking the lead at all times. And if you've ever wondered that you see somebody and you be like, oh, I work even harder than this person. I am able to do this, I'm able to do that, but they can't do it, but they have the opportunity. Why? Because they are confident. It is not just about being competent. You also have to be confident. Whatever you know to do, you need to show that you are confident in yourself. Because at the end of the day, even if you're dealing with a patient, if you present yourself as someone that is doubting their skill, you're already putting fear in their minds, and you're already making them to doubt you. And once you give that doubting face or make them feel like, oh, this person is not the perfect person, at the end of the day, they will not trust you. So that is to say that to be confident, it is also a skill, to be honest. Being confident at all times is a skill, because we might sometimes doubt our abilities. We might think lowly about ourselves, or just think, oh, am I really worth it? Can I really do this thing? Or because you previously made a mistake and now you feel like you're going to make that same mistake again. So it takes a lot of intentionality for you to build your confidence over time. And confidence, you can never be fully confident if you are not competent. And you can never be competent if you don't learn, unlearn, and relearn. Very important. Because things are changing. The way nursing was, the communication with patient is very important. Let me read what comment. Okay. Yeah, that communication with patient is very important, that we keep neglecting, instead focusing only on medication, which is really a bad practice. Yes, of course, Sidonie, it is a bad practice. Sometimes you see somebody, yeah, they are trying to, patient is not yet stable, but they are forcing to prepare medication. I tell you, who are you preparing the medication for? You've not even communicated with the patient. You don't even know what they are feeling at the moment. You don't even know if maybe in the course of speaking to them, you might identify a new need, that might end up meaning that you will not have to give them that medication. You're quick to start preparing medication to administer without even thinking if the patient is okay. So it is very important. Or sometimes we know this aspect of documentation is very important for our practice, but when you look at documentation in nursing, majority of people, they are focused on documenting, not because of the fact that they are interested in the continuity of patient care. They are just trying to back up themselves, which is totally understand, because things can get bad sometimes. But we should take our minds off documentation solely for the purpose of protecting ourselves in case of any legal charges or anything goes wrong. Always think about it this way. Documenting patient care is for continuity of care, and to make sure that there is a smooth handover within the team. So take, for example, if you come and the patient is not even stable, instead of you communicating with the patient, understanding what they are going through at the moment or how they are feeling, you go directly and you start documenting. Tell me, what are you writing? Or you're trying to fill notes, complete notes very at the start of the day, or you're hanging on the computers for those that do electronic health recording. So you're hanging on the computer and you're writing. What are you writing? Tell me, what are you actually writing? If you've not even spoken to the patient, you don't know how they are, the tendency is you end up copying what was written previously. And thank God I've remembered this point. You see the attitudes. I'm talking about especially to those that are new nurses here or those that are just studying. Please, you see the aspect of copying previous notes into your notes. Don't copy that habit. It is a terrible habit. You see the habit where you come and maybe you have the same patient in the ward that has been there for 3 days, and you just flip the notes to, let me say, the previous day and check what the nurse wrote, and you go back and copy. That is a terrible behavior. In case something goes wrong, or in case maybe something had improved on the patient's needs, and you do not mention that, you are in trouble. And you're not only in trouble, that means that the next person coming after you will not be able to follow up that patient's care. And that is going to affect continuity of care. And that's what many nurses on duty do, it is a terrible behavior. I beg you, there is one thing that you should take home today, is the fact that write your own notes by yourself. Never copy from somebody. Write your own notes by yourself. Write your own observation with your own words. Don't flip back to previous days and just copy. Oh, patient came in settled. Patient was diagnosed with this. Patient's BP is this. Patient is stable. What do you mean by patient is stable? If they ask you to back up, patient is stable, what will you say? And sometimes, to make it even worse, people do not even go for the rounds, but they come back and they jot down vital signs without taking it. That is it's a dangerous behavior. That is bad practice, like I will call it. It is bad practice. If you are unable to monitor patients' vital signs, please let the person taking charge over you say, just tell them that, oh, sorry, because I was too busy, I was unable to monitor the vital signs. You say, okay, I took the blood pressure in the morning. It was, let me say, 120 on 80. And now you want to do it in the evening because you are in a rush to go home. You just assume that, oh, it was 120 on 80 in the morning, so I'll put it at 122 to 1 on 80. That is so terrible. It is a bad thing. Because with vital signs are indicators. So if you're writing the vital signs that you've not actually monitored, what are you doing? You are harming the patient and you're putting yourself at risk. So when it comes to this documentation thing, please do not make the mistake of copying. I remember I once worked for a client, and because once we administer medication, you need to write it down. You need to write it manually. So one day, in the course of one of the staff writing the medication, instead of writing your own, when you administer, you write it by your own self. So you're just quickly going to check. So they transferred the wrong one when the doctor had already changed the prescription. So instead of the current prescription, the one that was being given that day, because they had the habit of copying from previous day, they copied that old one now and writing some that does not even reflect the current prescription. So the lady told me, once we gathered and he was talking to us, when she was talking to us, she told us, you know what? In this profession, never trust anybody's documentation. This is not for a bad thing. Never trust anybody's documentation. If there is anything you need to write it down yourself. Write it out with your own words. Don't assume that, because this person had already taken care of the patient, you understand something. They might miss out on something, and you yourself, you will copy that same mistake. I am really reiterating on this point because it is very common. It is very common, and sometimes your word church might say, it's fine, just leave it, or just copy, just transfer it. That is a dangerous behavior. That is one of the bad practices that you should not copy when you're still early in your career. Write your notes by yourself. And even if you are coming to continue with that patient the next day, please don't go back to copy your own notes, because I tell you, there is always something that will change about that patient. You cannot tell me that for the past 24 hours that you'll be looking after the patient is the same, nothing has changed. There must be an improvement, and it is important that you always state those changes, because those changes can also influence their next hospital outcomes, or if they will be discharged, or if they'll be left in hospital for a longer period of time. But if you take, for example, a patient has improved greatly on their care, they've improved greatly, and because you've been copying the notes previously from people and just including that without including that the patient has actually greatly improved. What does that mean? When the doctor comes for their rounds and they are following that information or whatever you're presenting, or maybe the nurse that is taking over from you is reading the notes and is seeing that, this patient is still the same. At the end of the day, what are you doing? You're harming the patient. Why? The more the patient stays in the hospital, the more they are exposed to hospital-acquired infection. The more they are more exposed to pressure ulcers because they are in bed, aren't they? Especially if they are older patients. That means every decision that we are making is very crucial. Every minute, every second, every hour that you see a patient, you are not only there to give medications or document notes, you are also there, you are playing a vital role in determining what next will become of that patient's care. So please, always consider that, always have it at the back of your mind that when a patient comes into hospital, they should go back better. They should not come into hospital with malaria and go back with pressure ulcer. It is not a nice thing. And that will also depend on the way we care for the patient. I know sometimes it can be a lot to take care of, but please think about it. Like I said yesterday, that patient could be your mother. That patient could be your father. It could be your brother. It could be your sister. Will you treat them the same way? That is the question. Will you treat them the same way? Because that patient you're attending to is somebody's mother or somebody's brother or somebody's sister or somebody's dad. So you need to treat them the same way you expect your own people to be treated. Because this aspect of just letting things go because it's not our own is very common. But please, let us not focus on being too task-oriented that we forget our human touch. The difference between us, nurses, and robots is the fact that we have that human touch. We can actually feel, we can listen keenly, we can actually be present, So if you take away your presence, your ability to feel, your ability to listen, then there is no nurse available. Sorry. There is just a robot that is there to administer medication, take care of patients, move patients left and right. But if you bring in the human feel, you bring in that compassionate nature of ours, that listening, where you're listening not just to quickly go through the patient's notes or just listen to the patient quickly and say, okay, I don't hear. Or maybe you're trying for the patient to quickly say what they want to say so that you can write on. You're listening to understand. You're listening to intervene. You're listening to give assurance to that patient. That is very important. That is something that we always have to take into consideration. And to round up with this session today, I would like to talk about well-being, health and well-being as a nurse. This topic, I can talk about it from today to tomorrow. Why? Because there is a lot of burnout. The research shows that majority of the nurses that newly qualify, they leave nursing even before the end of their first year in the nursing job. Why? They burn out quickly. And sometimes the burnout is not just because of the workload, it is also because of our expectations. The expectations that we have. Some of us come into nursing with so much expectations, or once we are still studying, we know that you see the study that I'm studying here, I'm equipped with everything. So once I go into the real world, I am ready. I tell you, you are just partly ready. There are a lot of things that you will learn in practice. There are a lot of things that you only come to learn them by yourself if you take that responsibility. And there are other things that it will need time for you to learn them. So first of all, have it in your mind, like I said yesterday, that nursing school will never fully equip you for real world nursing. It is not possible. How many simulation sessions do you have? How many times do you go on placements? How many hands-on procedures do you actually do? And how many times do they teach you in school about your well-being or other things like leadership in nursing or cultural intelligence, emotional intelligence, all of those things, or your health and well-being? How many times do they teach you that throughout your 3 years or 4 years in school? Very few. Some schools do not even have the opportunity to learn those things, but which are those things that are very important, right? So when it comes to health and well-being in nursing, your expectations also influence this. What you are expecting, how well you are prepared for the real world will also determine how well your well-being will be affected when you start working. You know, again, sometimes we go into nursing and we know that once we complete our nursing, we'll be able to help our families, we'll be able to take care of our own needs. But when we come into the field, we see that the reality is not always the same. And I don't know if some of you came through a communique where a hospital was actually advertising a job opportunity for healthcare professionals. I think there was a lab technician there, there was a nursing assistant there, and there was also a nurse there. Can you guess how much they were paying the nurse? I don't know if anyone has actually came across that. If you came across that, can you just indicate, please? Just 30 seconds for that exercise. There was a communique that was circulating online where a hospital was actually recruiting nurses. No, healthcare professionals. So I think there were nurses there. Okay, nurses. Thank you very much, Giovanna. That was 30K. That was 30,000 francs. 30,000 francs. So let's think about it this way. What if that hospital is somewhere, let me say in Douala or in Yaoundé or in Boya, where you need money to live? How much is your house rent? How much is your transport to work? How much are your bills? How much are you going to save? How much are you going to look after your personal needs? And how much are you going to take care of your parents with? So just imagine 30K as we are talking about it. And sometimes those hospitals do not even give you the 30K at the end of the month. They might carry it forward. And sometimes you might leave without even getting the money. So imagine 30K. So if you come in with that expectation that all of your things will be solved only by doing your bedside role, at the end of the day, you will be frustrated. I'm sorry to say this, but that is the truth. And when I saw that communique and a lot of people were ranting left and right, what I thought about was, what can we learn from this as nurses? What can we learn from it? What can you pick out as a nurse? It's okay to say, oh, this is bad, but what are you doing? That is to say that you need to think outside the bedside. That is just a fact. It doesn't matter where you are. You need to start thinking outside the bedside. You don't need to limit yourself to the bedside to say, okay, I'm just focused on bedside. Because look at 30,000. What is 30,000 going to do for you? Is it going to take care of your bills, pay your house rent? If you want to find a comfortable house, let me say if the clinic is maybe in Douala, how much is your house rent? It's a minimum if you want to find it in a good place where it will not be flooding with water. That is a minimum of 15,000 a month. That's just your house rent. So that is half of it already going for your house rent. So how much are you going to eat? How much are you going to pay for your transportation? How much are you going to save? And how much are you going to send to your mothers or your parents? So that is to tell us that we have to think outside the box. You don't need to just focus on what they are giving you as paycheck. We also started by talking about the importance of having a plan, degree, or what else you can do with your nursing certificates. Don't only think that you have to end up being an employee or you must end up where you are. That is something you need to think outside of the box. What are the opportunities in different places where you can actually exploit them? All right, so let me go back. Let me not go out of what I was talking about. So when it comes to this health and well-being, now, if you go in there with those kind of unrealistic expectations, what happens now? You start draining your emotional well-being. You start feeling like you're not enough, which is not even about you. It's not about you really. It is just the circumstance that you find yourself in. So one thing I want to tell you is have it at the back of your mind. Your nursing school will never equip you fully for real world nursing. There are things that you will need to learn. And again, you need to have a backup plan. You need to think outside of your bedside role and think about other opportunities that you can exploit that will actually help you. And again, when you look at this health and well-being again, we have this aspect of workload. Our workload is massive. It doesn't matter where you are. Everywhere we have that shortage of nurses. But sometimes when I talk about shortage of nurses, I don't go deep to talk about it. Why? Because you ask that, okay, how many nurses do the nursing institution in Cameroon train in a year? So where do they go to where we keep talking about shortage? So those are some of the things that we cannot even explain totally. But overall, let's talk about the ones that are present in hospitals. You see that the patient to nurse ratio is a big deal, right? The workload is too much, which means that sometimes if you're not very protective or very considerate towards your health and well-being, you will easily burn out. And again, a lot of new nurses, they do burn out. Why? Because they are not used to that pressure. Because when you're a student, you don't have that full responsibility. You're not fully accountable to your practice. But once you qualify and now you are in the front line, there are a lot of things that you need to do by yourself. So you are facing most of those things, right? So if you're not protective of your energy early enough, you will end up burning out quickly. Or you always be that kind of person that you're drowsy, you're forgetful, you're just once you get home, you're just like a shadow of yourself. You're able to do anything outside of work, or sometimes you can carry your stress from home into your job site and different things. And at the end of the day, your mind will just be everywhere. So that should tell you that burnout is real in nursing. It is real. There are days where I come back very tired. I'm feeling like, do I really want to do this job again? This is the truth, though. This is the truth. Sidonie, you can also attest to this. There are days where you come back and you'll be like, is this a job that I really want to do anymore? Do I really want to do this? Especially when it gets really busy, right? So you just this is not to create fear. This is to create that preparedness. Because the more informed you are, very true, thank you, Sydney, the more prepared you are, the more you are able to overcome those challenges. But if you just go in there thinking, oh, it's a bed of roses, I tell you, it will burn you out quickly. That is the reality. So that is to say that your time outside of work or outside school is very important. The things that you focus your time on is very important, because you don't expect to come into work and you're so tired and go back home and you're still stressed. At the end of the day, your life will just be stress. And what is it? How is it going to be if you're stressed all the time? You're unable to enjoy your own life. You're able to have a period where you're actually very joyful, or you're very happy with yourself. You're very comfortable. We should have those times. I understand there are down moments, but it should not be a constant thing. If you're down all the time, then it's a call for concern. You need to start looking into it. What are the things that I'm not prioritizing? What is it about my health that I'm not prioritizing? Because at the end of the day, we tend to focus a lot about our patients, looking after them, checking their blood pressure, making sure their blood sugar levels are okay, advising them, oh, eat healthy, eat vegetables. But how many times do we do that? How many times do we do that as individuals? How many times do we actually monitor our own blood pressures to know that, oh, it is normal? Or how many times do we actually pay attention to our own needs? Like maybe you have this headache that has been going on for a while. How many times do you pay attention to find out, is this because I'm stressed, or is it because I just need something to take it? But majority of times you just take the painkiller, suppresses the pain without us even analyzing what could be the underlying cause of that thing. So as nurses, we are our own advocate. So we can't talk about advocacy without looking after our health and well-being. Because at the end of the day, we need a healthy body to perform our job excellently. If you come in tired, stressed, it's most likely that you will make mistakes. But if you're that person that is always focused, your energy is always high. What does that mean? You will always provide excellent care. And you cannot care for others if you don't care for yourself, or if others do not care for you. That is why your circle out of work also matters. The people around you, are they constantly encouraging you? Do you have that person that you can actually come back after a very stressful shift and speak to them? Or if you're a student, after a very long day, when you have a lot of assignments, and if you're a year 3 student, it's even more, there's more pressure. You have this internship, you're doing your internship, you're completing your project, and all of those things can have a very negative effect on our health and well-being. But how do you manage it? How is your resilience level? Are you able to cope with everything? Because we are all resilient at different levels. There are things that I will be able to take, but there are things that you won't be able to take. So know yourself, know what you can take, know your limits, know when to say no, know when to step back, know when to move forward. It is very important. You need to know these things about yourself. So again, don't only be the person that can educate your patients and tell them, oh, you need to protect yourself, you need to sleep under a mosquito net, you need to make sure you're drinking enough water, whereas you don't even drink water at all, you don't even eat the vegetables you're telling the patient to eat, you don't even sleep well. Maybe you have 4 hours to sleep and you take 2 hours to scroll through social media, and before you know it, it's already 3 a.m. and you have to be awake at 5 a.m. You might feel like it's okay at the moment because you're relatively young, but tell me, in the next 10 years, what happens? Your health is going to deteriorate gradually. And it always starts with just little things. And before you know it, it's a big deal. So once we are there dedicating our time, our effort, and our energy to look after people, to look after our patients, we should also look after ourselves first. What are the self-care activities that you engage in regularly? For others, they just love music. For others, they just like going on walks. For others, they just like to come back and treat themselves with different things from time to time. Get to the habit of treating yourself. Oh, yes, you deserve it. Sometimes, you just need to step out from the noise and get something. If it's just you relaxing in one corner and just your mind and you thinking about yourself, it is very important. Create a wellness routine around your schedule. Have something that you reward yourself with. Have something that you're always looking forward to. If you have an evening where you just sit down by yourself, not talking to anybody, not on your phone, and just enjoy your own space, it is important. Sometimes it could be food. For some people, they just love eating nice food, nice healthy food, to be more specific. Have some time. Get that food from time to time. Get those treats. Treat yourself, pamper yourself. Sometimes you go to work, you come back, or even to school, and you have this headache, you're so tired, or maybe you've been in 12-hour shift and your legs are so tired, you can feel the aches. What are you doing about the aches? Let's not just be too focused about taking care of our loved ones and just bear the title nurse. Being a nurse doesn't mean you don't have feelings. Being a nurse doesn't mean you don't have needs. You do have needs, you do have feelings, and those needs, if they are not met, you will end up not being able to meet people's needs. It's just a fact. If you constantly feel like your needs are not met, I tell you, it will be difficult for you to meet the needs of others. So if you're unable to do it by yourself, at least have people around you. Again, the people you keep around you matter a lot. What do they tell you after the 12 hours you come back? What did they tell you after you've been in school from 7:30 to maybe 4:30? How do you interact with them? Do you have a positive relationship with people around you? Do you go back home and you have somebody that you can actually tell them, speak to them, and they understand you? Because it's one thing to be available and it's one thing to understand you. People that can actually understand that, oh, you see this job, I sometimes just give a lot, and now I need somebody to just also give me that comfort. You are a human being, I tell you. You need that comfort, that reassurance, the same reassurance you give to your patients sometimes. You need that reassurance. And if there is no one else to reassure you, learn to reassure yourself. Speak to yourself, make yourself understand some concepts, get to know yourself more. What are the things that trigger you? This goes to the aspect of emotional intelligence, which is also part of health and well-being in nursing. Because I tell you, there are days where people will annoy you, not intentionally and sometimes intentionally. There are days where you will meet difficult patients. There are days where you will meet difficult family members. I don't know if you've come across a patient where the patient is okay, but their relatives will keep telling the patient things to say, or keep telling the patient to, make it look like it is so difficult. Or even if they are not telling the patient what to tell you, they are even making things difficult for you. You will meet patients like that. Sometimes you will meet colleagues, you guys will not get along. Your personalities are just too different. And again, that also goes back to group assignments, because I remember when we were in level 3, where we had to do it was like a joint, where we defended our level 3 projects. We did like a joint, like 3 people in one group. Yeah. So there were a lot of groups that ended up in so much conflict. Why? Because of their personality differences. You always have to admit this. We are all different. Your personality is different from my personality. And sometimes if you're not able to recognize that, you will end up having those clashes. And those clashes can actually separate and bring that kind of division in any team. So you need to understand this. It is very important for your emotional well-being. You need to understand this thing. It is very important, because at the end of the day, you see, our emotional health, it can easily be drained, because we are a people-facing profession, right? Which means we encounter people on a daily basis. And if you don't develop that resilience, you will burn out quickly. Know what you take. And like I said yesterday, sometimes your interpretation of something is not always the right interpretation. Your colleague or your classmate or your benchmate might just say something. They didn't intend it to be that way, but the way you take it will also matter, right? If you take it in a negative way, you end up hurting yourself more. So if you are letting go of some things, you're not letting go for that person. You're letting go for your own self, for the sake of your own health. You're letting it go for yourself. So always think about yourself first. It sounds selfish, but this is the truth. Always think about yourself first. Anything that you are letting go, you're not letting go to ease off someone else's stress. You're letting go for your own health. Because sometimes you'll be like, oh, this person hurt me so much, I will not let go. When you hold on to those things, what are you doing? You're weighing down your own self. So know it. You will meet your colleagues that you guys will not just get along. But again, mutual respect is very important in any team, right? And the way you say things, the way you respond to things matters a lot. Even if you are right, the way you put out information out there, or the way you say something, can end up making you look wrong, right? So at all times, no matter how annoying it is, try as much as you can to be respectful in your approach. Don't always be confrontational, right? Because sometimes the way our body language even speaks more than the words that we speak. If you're coming to say something and you are coming in a confrontational manner, there are different ways in which you can look confrontational. For example, you're coming to talk to somebody about something and you're holding your waist, or you have one of your legs in front and you're nodding your head, like something like this. What are you doing? You're already confrontational. And even if you have to say something, you end up being looked at it in a wrong way. Why? Because your body language is saying something else. And our body language, 80% always speaks more than the words, and people will focus on our body language, right? Or maybe somebody is talking to you and you're just looking over there, or you're looking at them from head to toe. That is not the respectful. It's not very professional, right? So it's now that we learn all of these good behaviors, so that at all times you will not only be excellent in your clinical skill, but you will be excellent in the way that you present yourself and your approach to people. Know this: you will never be the same as everybody. You will never be understandable, and sometimes you will never totally understand others. Some people will misunderstand you, but that doesn't mean you should respond in a negative way, or you should try to confront people, or you should always try to be right. Sometimes you just apologize, not because you feel you are wrong. It's just because you just want to keep your peace. And please, this is not only when it comes to personal relationships outside of work. Sometimes at work, yeah, in a professional setting as well, you can just let go of some things. Not because you feel like you're not right, or because you feel like, oh, if you let it go, it means you're a weak person. No. And I'm not like trying to say if there is a behavior that is consistent and is negative, you shouldn't call it out. Call it out, but do it in a respectful way. Go to the right quarters. If you have any worries, channel it through the right quarters. Don't just stand. Maybe, take for example, and this is very common, yeah. Maybe two of you are attending to a patient and you have conflicting ideas. It is not the right thing to stand before that patient and argue. You don't do that. It's not professional. Once you start doing that, what do? You are already making the patient to doubt your ability. Your patient will start thinking, oh, are these people about to hurt me or so? So try as much as you can to keep it, calm down, take it to the nursing station and deal with it there. If there is something you want to correct your colleague about, please take them aside and correct them. Don't always try to be the right person. Or if you know something and they don't know something, don't feel like, oh, because I know, it means I can just speak the way I want. I can just correct them anywhere. No, we are all professionals. We are all here to help one another. And we should do that in a respectful way. We shouldn't do it in a way that we will end up belittling others. It is not a nice thing. If you have all the praises and others are left behind, you won't gain anything. Your goal should be to look for ways to uplift one another. If you have anything, if you have an opportunity, share it with people. If you have something that you think that someone else can benefit from, share it with them. Because at the end of the day, the more you share, the more you're able to learn. Don't just say, oh, because you don't understand this thing, I will just step back. You know, I remember when we were still in school, Sidonie, I know you remember who I'm talking about. We had one of our classmates where he will only correct you when he wants to challenge you. So when you are explaining a concept, he will not come to, when you're all doubting something and somebody is coming to explain it to you because they want to understand. When he comes, the first thing he will do is he will stand there looking at you people and he will ask an very intimidating question. When he asks that question, what is he driving at? So that he knows that you guys will not be able to answer the question. He will correct you. And when he answers that question, I tell you, you will live with your heart very heavy. That was his nature. And it was a terrible, unprofessional behavior. So we shouldn't be in that. We shouldn't be like that. If your colleague is doing something that is not right, or if your fellow student is doing something that is not right, call them aside. They might not even know about it. Just speak to them nicely and say, oh, I thought this is what you should be doing. Yeah, those people are always present in any classroom. Yes, Sydney, that's true. They are always present in every classroom. You know, you see the life after school. Yeah, let me just tell you. You see life after school is different. You see your colleagues, you see your classmates, treat them nicely. You know why? You don't know where you will meet them. This is not even part of the event, but I'm just telling you on a general note. You see your classmates, or even those that are all in this group, as we are in the same WhatsApp group, you see everybody, treat everybody nicely. You don't know where you will meet them tomorrow. I'm telling you, it is a fact. We live in a very small world. And sometimes you might say, oh, I don't know this person personally, so that means I can just treat them anyhow. No. Tomorrow you will meet them somewhere. Or just by interacting with them, they might refer you. They might recommend you. They might even say something that will end up helping you. So don't just treat people nicely because they are connected to you, they are your friends, or because you know them on a personal note. Treat everybody respectfully. Don't have a scale where you weigh people. You say, okay, this person, I think this person performs well, so I will bring them close to me. Or because this person has more authority, you'll be like, okay, I'll come closer to them. I will say good morning to them. I will greet them. But this other person that you're just looking down on, you just treat them anyhow. It is not a good behavior, especially in the class where you don't know who is who. Sometimes you sit with people and you think that, oh, because you all are doing nursing, you think you're on the same level. No, you're not. You're not. Just know this as a fact. You are not. Respect people, your classmates, treat them nicely, so that even if you don't meet them later on, you always be at peace with yourself that I actually treated this person nicely. And again, I know there are some people that will always be very troublesome, right? I do acknowledge that fact, but there is a way that you can create a healthy boundary without being disrespectful or without being dismissive. There is a way. It's all about finding a way to do it that way. Yeah, so we will be this is like almost an end to our event. And I hope that the presentation of today has been very helpful regarding the LinkedIn accounts, to create them and go over them. I think we are going to do it in our WhatsApp group so that all the steps will be dropped there. Because if I'm telling us now, it might be difficult for us all to catch up on the same page. So Stanley and I, we are going to make sure that we do it in the group and give it step by step so that you just follow up and update it. And just a quick one on that one. Like I said yesterday, you don't need to be a content creator all the time. You don't need to write every day on your LinkedIn account, because I'm focusing on LinkedIn because it's very professional. It's a platform that is recognized nearly everywhere. It's a very professional, one of those very professional platforms that even if you don't want to belong on any other social media platform, you should have a LinkedIn account, a current LinkedIn account for that fact. Yeah. So the things that you need to consider is your LinkedIn account should have a profile picture, because with LinkedIn, you can't have two LinkedIn accounts. The same person, you cannot own one. So see how credible it is. You cannot own one person. You cannot own two of those accounts. So that means you need to have a picture of yourself, a cover photo, and then a description. There are a list of things that you actually write there. If you are a student, there is a place where you can fill it, where you study, what you currently do. If you have a side thing you're doing, you can include it there. If you're working or volunteering for any organization, you can put it there, and things like that. It is very important that you have that filled out. Or maybe your about section, you might be wondering, okay, I'm a student, I don't yet do anything. What can I put in my about section? In your about section, it could basically be maybe the things that you're passionate about or what you intend to do in the future. For example, if you want to get into research, like a research nurse, you can say, okay, I am this, I am that. I am very passionate about research nursing, so I am looking forward to connecting with professionals that can actually guide me through this process. That's really an about. So an about section is all about people knowing what you stand for. You get what I mean? Yeah. So we are going to go into it detailedly so that you can actually update it. Even if you update it now and subsequently, after some time, you want to continue, that's fine. But at least you have an updated profile where you've worked, especially if you've worked before. Even if you volunteered, write there that you volunteered. Because majority of the times, professionals or employers will not come to ask for your CV. They might even go directly to your LinkedIn. Why? Because it has all of those things that you're looking for, right? And to end our session today, I would like to talk a bit about volunteerism. This thing is very important, but I'm really sorry to say that there are a lot of people that have abused this aspect of volunteerism. So you end up exploiting others because they feel like, oh, you want to volunteer, now you want to gain experience, right? But the kind of volunteerism I'm talking about is not only on site, I'm also talking about online volunteerism. And this will really help you if you are someone who wants to get into a particular specialty. Let's take, for example, mental health. If you're very passionate about mental health nursing and you want to get into it in the future, what can you do? You can find mental health organizations online and volunteer. What are you volunteering for? You can just volunteer to talk about your programs, go on their outreach programs if you're able to meet, if it's somewhere that is convenient for you. But look for something related to your specialty that you intend to get into and volunteer there. It could be an NGO. Even if it's just if you're a good writer, you could just write for a company or an NGO and just say, okay, you're volunteering. But make sure that you are very, very conscious. Don't be exploited and say Kendria said you should volunteer and now you've been exploited, because there are a lot of people that are out there to exploit others. But look at the positive side of it. Find an organization where you can volunteer. And sometimes when we look at volunteerism, you don't need to put in all your time to do it. You can just say, okay, I'm dedicating 5 hours of my day in a week, or maybe 2 hours, and you're just promoting their initiatives. At the end of the day, it will even help you to understand and learn more about that specialty. You get it? And again, you can just say, I'm volunteering for 2 months, 3 months, 4 months, 5 months, 6 months. If it's burning you out, please stop. If it burns you out quickly, if you see that you're doing too much, try to reduce the hours in which you're volunteering, or see if that is something that you really enjoy doing, right? But please volunteer. Anything that you want to do later that you've not been doing it now, find an organization that is very, very into that particular thing and volunteer. And volunteer doesn't mean you must be doing something, you know. If you just show that interest and ask, okay, is there any way that I can, thing that I can help with? You might think that you have nothing to offer, but there is always something that you can offer as an individual. Know this, you always have something to offer. Until you ask, you won't be able to know. You can't just decide that, oh, because I'm not good at this, I'm not perfect in this, that means I cannot contribute. You can always contribute. We all have something that we can contribute. So I hope that this session was really helpful. And again, we've not gone through all of this worksheets. There are different sections that we've not actually covered, but you can go through it as an individual and let me know if you have any questions. And again, okay, so I wanted to end this way with this worksheet, especially the section that talks about Nurse Career Accountability Planner. Please, based on what we've been discussing from yesterday on to today, at least now you should be able to have a plan. Or even if it's not a well-crafted plan, you should have at least a clue of what you want to do in the future regarding your nursing career. If you're a second-year student or third-year student or just newly qualified, it still applies to you. So please, I'll just read a couple of sections here for you to understand. So the first section says career identity and foundation, and it starts with different nurse statements. And it says, I am building a nursing career that is rooted in purpose, competence, ethics, and continuous improvement. The first subsection that says long-term vision. My ultimate nursing career goal is, you need to fill this in. Please, this worksheet is not just for the purpose of it. If it doesn't help you, at the end of the day, there was no need attending the event, really. Because it's not only about being present, but at least the tools should be able to help you to better and have a plan about your career. So you should be able to write down your ultimate nursing career goal. What is it that you want to, like a big picture of your nursing career? What is it that you want to achieve out of it? And then the next thing says, in 2 years, I want to be known for. What do you want to be known for? If I say Akines, what do you want to be known for? Tabitha, what do you want to be known for in the next 2 years? So you need to write that statement down. Then the next thing says, the kind of nurse I am becoming is someone who, what kind of nurse are you becoming? Are you becoming a nurse that is just comfortable with average, or are you somebody that is striving towards being outstanding? That is what you need to be answering. And this is going to shape your plan a lot. And the next thing is your strength and your areas of growth. What are your strengths? And this goes back to your superpower. What are the things that you're comfortable doing effortlessly? That is your strength. Are you someone that is very, very resilient? Are you very emotionally intelligent? Are you someone that is able to pick up a skill quickly? Those are your strengths. And then, for example, what are your weaknesses? You could be somebody that is quick to react. You could be somebody that is maybe you don't really get a concept at one time. You need to be told over and over. Those are the kind of things that you need to think about yourself, because the more you know yourself, the more you're able to improve on yourself. What are your weaknesses? Do you take things personal? Are you someone who is not really conscious with your time? That could be a weakness that you need to state. You state it out clearly. And then for the actions now, the first one says, pick one area to improve in the next 14 days. So in the next 14 days, what do you want to improve? Is it your emotional intelligence? Do you want to start learning how to create more boundaries? Do you want to learn how to be more interactive, or to be more somebody that is able to speak publicly? Do you struggle with speaking publicly? And now, in the next 14 days, I will be practicing on public speaking, or just looking at the mirror and speaking, or just saying something. And if you're able to use your 1 minute pitch, and again, I will be expecting everybody to drop their 1 minute pitches by tomorrow, please. in 1 minute, you're not writing. I'm not asking you to create a video. I think that's a very difficult one, but just write it out. If you say it to yourself in 1 minute, you should be able to know what is a content of 1 minute, right? So please drop your 1 minute pitch in the group. Just say, if somebody comes in and say, Tabitha, can you tell us a little bit about yourself? You should be able to answer that question, because you're already selling yourself. Just that pitch is you're already selling yourself, because within those few words lies what you do, and that 1 minute is already so much time for you to create that first impression in people's minds, right? So you need to choose one of those skills. So it could be a hard skill, or it could be a soft skill. It could be a clinical skill. For somebody, it might be like, oh, I'm not really good at this cannulation thing. So now you need to perfect that skill in the next 14 days. You need to, and if you want to do like a skill that is a clinical skill, if you go back to the 6-point framework for learning a skill, you use that framework now, you're going to perfect that skill quickly, right? So that is just the section 1. So there are more sections, like the 4th section says, career values and work environment. What matters most to you in a workplace? For me, there are things that matters to me. For example, for me in a workplace, I love a supportive team. That is so important to me. I don't want to come in and I'm struggling to do everything while everyone else is loitering around. That is important to me. Somebody might be able to cope without a supportive team, but are you that kind of a person? And then there are other people that love to have this aspect of, that continuous learning. They always have somebody that is teaching them something. Are you that kind of a person? So that will also guide you to know yourself better, so that when you're getting into a work environment, you already know your expectation as an individual, right? And again, the next thing is my top 3 career values. What are your career values? There is no way you can be an excellent nurse without having your values. And this value sometimes could be your personal values that you're bringing into your career, right? For some people, it's timeliness. Like I was saying yesterday, for me, timeliness is my very, very important value that I don't joke with. I prefer to sacrifice my extra 30 minutes of sleep and be present in the place 30 minutes before time rather than coming late. Sometimes 5 minutes before time to me is late. That's me. It might be different for you. So it's all about knowing yourself and knowing what values you stand for. And your past experience, what have been the most impactful clinical setting you've been there? What do you learn from that environment? Especially if you're a student that you go on different internships in different places. How did you find this ward? How did you find that ward? How did you find this hospital? How did you find that hospital? How can you learn from it? So these are the kind of things that we need to take into consideration. So there are other sections. So I just picked this section and just capitalize on. But what I'm trying to say is, please go through this planner and plan your career. Attending this event is one thing, and having that change is another thing. Between now and the next 60 days, if nothing changes about you, then actually you wasted your time, you wasted your energy, and you wasted your money to attend this event. But that should not be the case with you. There should be one thing that you've picked out from this event, that you are intentional about executing it. Please don't just go back and feel like, oh, attending this event, it was so impactful, I learned a lot. What is the lot that you learned? You should be able to justify or clearly state that this is what I learned, this is what I implemented, and these are the results that I am seeing. So that your goal should not only be to participate like this, but at the end of the day, you should be able to implement and see the results. The difference between people that attend numerous events and people that actually make a difference is in the implementation. So pick one thing. You just need to dedicate maybe 30 minutes of your time in a day to actually focus on your career. And before you know it, you will see that in the next 60 days, you will be a different person. Your perspective, your perception about your career and yourself will change. The way you see nursing and the opportunities that are in there will be completely different. And the way you will start positioning yourself is equally going to change. So please do let me know if you have any comments or any questions in the comment section. And this brings us to the end of our event. So now I'm open to any questions, any doubts, anything, just drop in the comment section. Or if you're able to unmute your mic and speak, that's totally fine.